Hi, good morning, dear students. So today we are going to discuss about the sympathomimetic substances. Okay, so before we start discussing, we must have to understand the sympathomimetic very quickly and at the very fundamental and basic level. Okay, so when we are talking about the sympathomimetics, that is nothing but the autonomic nervous system, sympathetic system, and sympathomimetics means that's the mimicking the sympathetic system, that is called the sympathomimetic substance. Okay, so let's we jump into sympathetic system. What is the main function of sympathetic system? Fight and flight mode. Okay, so some of the students, they can recollect the story of Ramesh that we have explained during the sympathomimetic explanation. You have to understand from the top to bottom, each and every organs are intervened by sympathetic and parasympathetic system. That means this is very important concept. We are not going to touch upon the entire concept today. We just want to give you the brief. Okay, so sympathetic system mainly work on alpha and beta receptor. These are the two main receptors are acting. When we are further divide these receptors, we can divide alpha 1, alpha 2, beta 1, beta 2. Another important point that we have to keep in mind is distribution, where these receptors are located. Alpha 1 receptor is mainly located in blood vessels. This is alpha 2 receptor that located in the central nervous system. Beta 1 receptor is mainly located in myocardial muscles, means heart. Beta 2 receptors are located in skeletal muscles, blood vessels. Okay, so this is the pretty much main basic distribution. Beta 2 receptors is also present in all other vital organs like lungs, uterus, and also other organs. But our main intention is to cover this part today. Alpha 1 receptor, sympathomimetics that act on the alpha 1 receptor. That's called the vasoconstriction. But at the same time, they call the skeletal muscles vasodilation. What is the meaning of that? That means if you can recollect the story of Ramesh, when the Ramesh is like, I can quickly re-explain the story if some of the students, they haven't heard that story. Ramesh is living very close to the jungle. When Ramesh is passing through the jungle, he encountered the lion in front of him. During that time, the Ramesh start thinking two things. Either he can fight against the lion or he can flight from that situation. Okay, and the Ramesh was very focused at that point of time. That means his concentration is at the extreme level. That is the one point. Remember this word, okay? Focus and concentration is at the peak, because he is not going to get any other thought other than what need to be done at this point of time. That level of focus and concentration he has developed. And finally, he has decided to run away from that situation. So his mind, body, and internal organs are start getting prepared for that situation. Start from the eyes, because he is running through the jungle, so his eyes are going to be dilated. Second thing is his heart is going to pump very fast because his body required more oxygenated blood. Third, his lungs is going to be opened because he need more oxygen for the energy. His liver is start releasing more glucose into the bloodstream because he need energy for running. Fourth, he required his hands and legs required more blood flow and more energy. That's why the blood vessels of his hands and legs are going to be dilated, blood vessels. At the same time, at this point, the internal organs required less blood, so the internal organ blood vessels are going to get constricted. Okay, an entire blood flow is diverted from the internal organ to hand and legs. He is not going to get chances for urination, or he is not going to get chances for latrine. That means his sphincter, okay, bladder, urinary bladder sphincter is going to be constricted, and his detrusor muscles is going to get relaxed. That means the bladder is going to be tight at the bottom. That means this the sphincter part is going to be locked, and this become more relaxed. So urine holding capacity is increased. So once the situation is resolved, then Ramesh get urination. Okay, so like during the running, he is not going to get opportunity because otherwise the line is going to catch him. Second thing is the same thing in intestine. Intestine sphincter is going to be constricted, and intestinal muscles are going to get relaxed. So if you are going to look from the top to bottom, each and every thing that happened, that is because of the sympathetic system. Focus required sympathetic system. That's why ADHD patient, those patients who are suffering from attention deficit hyperactive disorders, they required sympathomimetic substance. Second is the pupils need to be dilated. So pupil dilation can be achieved with the use of sympathomimetic substance. Third is cardiovascular outflow. That means positive inotropic effect and positive chronotropic effect that can be achieved with the help of sympathomimetic substance. Lungs dilation. Okay, lungs dilation can achieved with the sympathomimetic substance like beta agonist. From that point onwards, if the patient is suffering from hypotension and we required pressure, okay, so we can achieve alpha 1 receptor stimulation can cause the vasoconstriction and pressure rebuilding. So all these activities are because of the sympathomimetic system. Now carefully you can recite this story, understand each and every physiological activities that happen in the body, that is because of the sympathetic system. If you are going to remember this part, you are ready with what is the effect of sympathomimetic, what is the effect of sympatholytics, what is the effect of parasympathetic, and what is the effect of anticholinergic. So all the four concepts are going to be cleared, because sympathetic and parasympathetic are considered as the physiological antagonist. That means the opposite effect, and the whatever effect we can expect with the sympathomimetics, the similar kind of similar effect we can expect with the anticholinergic medications. Okay, so this is the overview for the very generic understanding of the sympathetic system. Now you just have to focus on alpha 1 and beta 1 related activities. Alpha 1 is vasoconstriction, beta 1 is improve the cardiac outflow, that's the cardiac output increase. Beta 2 receptor can cause the vasodilation. Okay, so the combination, each and every medications of sympathomimetics, they have a different affinity towards these receptors. Second is depend upon the what level of dose, the effect might be changed towards the receptor. These are the two very important points you have to remember. Okay, so receptor specificity and dose, these are the two important parts, will determine the what kind of final effect we can expect when the patient is taking this kind of medications. Okay, compensatory reflexes are the different things. When the vasodilation is there, so refractory cardiac tachycardia can happen. Okay, that's kind of compensatory reflex can be possible. So what are the important medications that we are going to look today is, one is adrenaline, other one is noradrenaline. So these are the two main drugs, adrenaline and noradrenaline. Other is dobutamine, dopamine, isoprenaline, and metaraminol. Okay, so these are the medications considered as a sympathomimetics. Each and every medication has a different level of effect on the different receptors. Mainly these medications have two primary purposes. One is the medications used for heart failure. That means if the patient has a severe cardiac outflow is significantly low, we can improve the cardiac outflow with positive ionotropic effect. Second is if the patient has collapsed the entire pressure system, that means patient has a severe hypotension. Okay, so we can give this kind of medication that can increase the pressure and maintain the hemodynamicity. Okay, arrhythmia, especially the bradycardia, this kind of situations can be improved with such kind of medications. Okay, anaphylactic reaction. What is the anaphylactic reaction and which medication is used? Anaphylactic reaction is nothing but the allergic reaction. In this allergic reaction, widespread, normally normal allergic reaction, for example, rhinorrhea or rhinitis. Okay, so rhinorrhea or rhinitis, this kind of allergic reaction is a very local area. Histamine is released and that histamine is causing the vasodilation. But when the widespread in entire body is a widespread histamine release, that can cause severe vasodilation. This severe vasodilation is collapse the cardiovascular system. That means heart is not feeling the enough pressure. So the cardiac function is deteriorate. Pressure is not maintained in the blood vessels, so the vital organs like kidney is not getting enough blood for perfusion. Okay, that's the kidney, and also your brain is not getting enough blood. That means the entire system is collapse. That is the anaphylactic reaction. So what kind of situations, like how we can manage this situation? We have two different and unique kind of expectations. One is the substance that can cause a vasoconstriction. Substance that can cause a vasoconstriction. So this histamine induced vasodilation need to be countered. Okay, so the substance that can cause a vasoconstriction, and second is that can improve the cardiac outflow. That means the medication which has a potential to act on alpha 1 and beta 1 receptor. Okay, so this unique kind of action we can expect with the adrenaline, and that's why the anaphylactic reaction is managed with the help of adrenaline. And normally those patients have anaphylactic reactions. They are using the self-administration adrenaline injections. Commercial name is EpiPen. Okay, so epinephrine, EpiPen. This is the name you have to remember, and this is a very, very important point. Bronchospasm. Again, the bronchospasm, as we have seen this story, the bronchospasm is also relieved with the help of sympathomimetic substance like beta-2 agonist. Okay, so the main use is hypotension and heart failure. This is the main use. Anaphylactic and arrhythmia and bronchospasm also we can use the sympathomimetic substances. Perfect. So today's most important part is this table, and definitely you can expect the question in your exam from this table. First, you can understand the comparison. Okay, these are the drugs: adrenaline, dobutamine, dopamine, isoprenaline, metaraminol, and noradrenaline. This is the receptors: alpha 1, beta 1, beta 2. Alpha 1 is vasoconstriction. Beta 1 is positive ionotropic and cardiac outflow. Beta 2 is skeletal muscles vasodilation. Okay, So when we are talking about the adrenaline at the low dose, that has an effect on alpha 1 and beta 1 receptors, and that's called the vasoconstriction. VD means vasoconstriction, vasodilation, vasoconstriction, ionotropic and chronotropic effect. Okay, vasoconstriction and vasodilation. Look, comparatively, when we are looking at the adrenaline at low dose, the alpha 1 is a 1 plus and beta 2 is a 2 plus. That means the beta 2 mediated peripheral vasodilation is the domination. Vasodilation is a domination. That means we are getting the effect like vasodilatory effect. But when we increase the dose at the high dose, that's the dominant effect. Dominant effect is on alpha 1 receptor. Alpha 1 receptor causes the vasoconstriction. When the vasoconstriction, okay, so effect of adrenaline and noradrenaline. This is very, very important to remember. Very, very important to remember. Adrenaline and noradrenaline. In other class I have explained about the comparison and comparative graphical representation. Okay, so might be you can expect that kind of question in your examination. Which medication can cause the hypertension, which medication can cause the hypotension. So you have to understand this table, and based upon that you can make your decisions about the medications. Adrenaline at the high dose can cause hypertension. At the low dose, adrenaline can cause hypotension, low blood pressure, and at the high dose is high blood pressure, because the affinity towards the alpha 1 receptor is increased with the dose. Okay, so this is very, very important part you have to remember. On the other side, noradrenaline has a dominant effect on the alpha 1 receptor, is a very limited and minimal effect on the beta 1 receptor. That means the noradrenaline is mainly causing the vasoconstriction. This is the difference between adrenaline and noradrenaline. So you must have to remember this difference. First, adrenaline and noradrenaline. In normal situation, adrenaline has a more effect towards the beta 1 receptor, and noradrenaline has a dominant effect on the alpha 1 receptor. That is the point you have to fix in your mind. Based upon that, might be you can expect the questions. Second drug you have to remember is dopamine. Dopamine is also very important medication for very important medication for cardiogenic shock, because that medication can cause positive ionotropic effect like beta 1 receptor mediated actions, so improve the cardiac outflow, and that also effect on the blood vessels as well. Okay, so that means the dopamine is very important medication when the patient's cardiogenic shock or any other shock like anaphylactic shock or cardiogenic shock, the entire system is collapsed. In that situation we require two things. One is the medication that act on the blood vessels, and also the medication is improve the cardiac outflow. So dopamine has very unique activities that can cause improve the blood flow to the kidney as well. Okay, so dopamine low, intermediate and high dose is little bit change the effect. When the dopamine high dose is mainly effect on the alpha 1 receptor, and low dose that doesn't have any effect on the alpha 1 receptor. Okay, so this is very important point we have to understand. So when the low dose that can cause the hypotension, and the high dose that can cause the hypertension. Okay, dobutamine is straightforward. That is, dobutamine is only act at the beta 1 receptor. That means dobutamine has a very clear-cut function. When the patient has a significantly low cardiac outflow, in that situation we can give the dobutamine, and that can improve the positive ionotropic effect. Extreme on the other side is metaraminol. Metaraminol has only major effect on the alpha 1 receptor. That means the patient is suffering from a severe hypotension, especially When the patient is undergoing the surgery or operation, during that time the anesthesia or the blood pressure is significantly dropped down, we can give metreminol. That medication is causing the alpha 1 receptor mediated vasoconstriction and restore the normal pressure. Okay, so these are the two extremes we have to keep in mind. The another medication is isoprenaline. Isoprenaline is acting on two things, beta 1 and beta 2 receptors. Okay, so when the beta 2 receptor, that is improve the cardiac outflow, and the beta 2 receptors, that is improving the blood flow towards the skeletal muscles. Okay, so that is the flow and pattern you have to learn these drugs. First, you have to learn the adrenaline and noradrenaline. Second is dopamine. Third is two extreme drugs like dobutamine and metreminol. And the fourth is you have to understand the isoprenaline. Okay, and couple of times if you are going to look very carefully and try to find out the what's the dominant effect and the what dose is making the main effect, so comparatively you can get the better understanding. But your main area of learning is alpha 1 receptor can cause the vasoconstriction, beta 1 receptor improve the cardiac outflow, and beta 2 receptor is dilating the blood vessels of your skeletal muscles. So if you are clear with these three parts, easily you can understand the vasodilation, vasoconstriction, ionotropic and chronotropic. Chronotropic means beats, ionotropic means force. Okay, done. Another point is sympathomimetic must be guided by the hemodynamic monitoring, because hemodynamic is very important. Blood vessels and cardiac functions are directly associated with the sympathomimetic, so always we have to monitor these things. Continuous ECG is required. Atrial and venous pressure need to be checked. That is the obvious things. Prolonged use may result diminish the therapeutic effect due to down regulations of the receptors. That is also obvious. When any of the cell is exposed to the agonist for longer period of time, these cells are going to be down regulated. Down regulations can be achieved by two ways. One is they decrease the number of receptors and that decrease the sensitivity of the receptor towards that agonist. Okay, so that is called the down regulations. At the similar concept you must have to understand, that's called the up regulations. When any of the cell is continuously exposed to the antagonist for longer period of time, that is called the up regulations. This up regulations is either increasing the number of receptors or increase the sensitivity of the receptor. So we have already explained this concept in pharmacodynamics, up regulations and down regulations, but here you just have to understand if prolonged use can diminish the effect because of the down regulations. Combination of the sympathomimetics may be used because as we know, the sympathomimetic substance has a different affinity towards the different receptors. Okay, so these are the points, and now we can come to the question and answer. Okay, so sympathomimetics, question and answers. What do sympathomimetics mimics? Okay, so sympathomimetics are mimicking the normal neurotransmitters. Okay, noradrenaline and adrenaline. Okay, noradrenaline and adrenaline. Noradrenaline is considered as a normal neurotransmitters, and adrenaline is present in adrenal gland. When in our day-to-day life, normal situations can be taken care by the noradrenaline, but we need excessive response of the sympathetic system. In that situation, we need more substance like adrenaline. Okay, so they are mimicking the effect of adrenaline and noradrenaline. Which receptors are targeted by the sympathomimetics? Alpha and beta. Subdivide alpha 1 and alpha 2. Make sure every time, whenever I get opportunity to speak, always I speak alpha 1 receptor antagonist are used, like a prazosin is used for management of blood pressure, antagonist. And alpha 2 receptor agonist like clonidine is used for blood pressure management. Why? Because this alpha 2 receptor is central nervous system that shut down the entire system. Okay, that is called the negative feedback mechanism. Okay, so that is the part you must have to remember. Beta 1 and beta 2 receptor. Beta 1 is cardio, beta 2 is mainly lungs and peripheral blood vessels. Name two factors that determine the sympathomimetic effect. One is the receptor specificity and second is dose. What is the main use of hemodynamic monitoring? Because hemodynamic monitoring is required to guide the individualized treatment. This medication is mainly act on the blood vessels and the cardiac outflow. Name any two conditions treated by the sympathomimetic. Treated by the sympathomimetics, mainly hypotension and heart failure. Okay, what happened with the prolonged use of sympathomimetics? Prolonged use of sympathomimetic can cause the down regulations of the receptors. Which sympathomimetics have a positive effect on the beta 1 receptor? सोचो बीटा 1 रिसेप्टर, डोमिनेंटली बीटा 1 रिसेप्टर के ऊपर कौन इफेक्ट देता है? बीटा 1 के ऊपर डोमिनेंटली दो चीजें इफेक्ट करती है. वन इज डोब्यूटामाइन एंड अदर वन इज आइसोप्रेनालिन. Okay, what is the effect of adrenaline? Adrenaline at high dose on alpha 1 receptor. Adrenaline high dose is strong vasoconstriction. Adrenaline at low dose, that's the mainly effect on beta 1 receptor. Which drug has a vasodilatory effect at the low dose? Dopamine or noradrenaline? Vasodilatory effect. Okay. Noradrenaline has only one vasoconstrictory effect. Dopamine at the low dose is a vasodilatory effect. Which sympathomimetic has no beta 2 receptor activity at any dose? Metaramonil. Mainly metaramonil has effect on alpha 1. Okay, what is the chronotropic effect of dobutamine? Mild positive chronotropic. Dobutamine. Which sympathomimetic is used for both anaphylactic and cardiac support? Cardiac support and anaphylaxis, both the conditions, adrenaline. Okay, so anaphylaxis, two unique requirement. One is the vasoconstrictory effect and positive cardiac outflow, and the cardiac support is mainly positive cardiac outflow. So that is a uniqueness of the adrenaline. What happened to the therapeutic effect if the receptors are down regulated? Effect is decrease. Okay, can sympathomimetics be used in combination? Yes, can be used in combination. What is the ionotropic effect of metaramonil? Mild positive ionotropic, because major effect is on alpha 1, minor effect on beta 1. Which sympathomimetic has the strongest vasoconstrictor effect? Strongest sympathomimetic has the strongest vasoconstrictor effect. Noradrenaline is majorly effect on alpha 1 receptor. What is the beta 2 activity of the isoprenaline? Beta 2 activity of isoprenaline is relatively good. Okay, isoprenaline and dobutamine, that is the difference you have to understand. Isoprenaline has the effect on beta 2 as well as beta 1. Which drugs show positive ionotropic and chronotropic at intermediate dose? Positive ionotropic and chronotropic, dopamine. What is the vasoconstrictor activity of the high dose dopamine? Vasoconstrictor effect. Where should sympathomimetic therapy be ideally administered? Intensive care and monitored hospital settings, because this is very risky management. Okay, so these are the points that you have to keep in mind. Sympathomimetic is very important. With only we have just touched upon the cardiovascular perspectives, only cardiovascular perspectives. Okay, but when you are going to learn the sympathetic system, at that time you have to understand the entire system and the effect of sympathetic agonist and antagonist on all other systems as well, on the eye, on your lungs, in liver, in bladders, in intestine. Okay, so sympathomimetic is very important concepts to learn for your exam point of view and to make your pharmacology much easier. Okay, so so far we have completed pretty much all the concepts related to heart failure and related medications. In next class we are going to touch few more cardiovascular medications, and probably we are going to complete the entire concepts in next week. Okay, so thank you very much for joining today's class, and see you in the next class. Have a great time. Bye bye.